The government, it has its hands full. They don't have enough staff for their own hospitals. They don't have enough facilities for their own hospitals. Nationalizing is not the answer, because what does that mean? All hospitals are borrowing money to stay afloat, to pay the salaries.
I wanted to start straight away by asking you a question that we've received maximum queries on, and that is that why are private hospitals asking for a COVID-19 certificate from me if I don't have coronavirus, I have other illnesses, along with stories of where people have gone from hospital to hospital to hospital and eventually have died. So this is sort of a prime concern amongst people. I want to ask you that question.
It's a very good question and a very legitimate question. But as you know, today, nobody knows whether they have it or not. They may be carriers, silent carriers. As you know, 80-85% will be asymptomatic. So there is no foolproof way of protecting yourself from the virus, from COVID-19. But there are many things you can do to prevent it from easily accessing you, or like saying, do not invite it. So it is for the protection of everybody that this protocol has been made. Because if patients come in, we put them in a yellow zone if they are not tested already, and they are separate from each other. They are in individual rooms. We do the test right away, and we are finding faster and faster ways of doing it so that they are not inconvenienced. And then as soon as they are cleared, they are sent to the regular wards. Okay, but then there are some people who have come from outside. They need to be admitted right away. Admit them in the yellow zone, get their tests, and be done with it. So it's a little bit of a stretch for people, but at the same time, it's for their safety.
A lot of complaints about from people saying that if I'm admitted in a private healthcare facility, the bills are far more than they would have been had I been admitted for dengue or any other disease. And how do we justify the amount that is being charged to us?
So you're right. It is a burden on everybody, on the public, on the patients, and also on the hospitals and caregivers. Right. So I'll give you the components of it. So if you're COVID positive, you're in a ward which is isolated, every attendant, whether it be the doctor, whether it be the nurse, whether it be the housekeeper, whether it be the food supplier, or the GDAs, everybody has to have a PPE per shift. And you cannot have, if you're in a PPA, you're on a 6-hour shift. So instead of 3 shifts, there are 4 shifts. Then they work for 2 weeks and they have to be rested for 2 weeks, which is paid for. So what you're saying is the PPE by itself will cost on an average 1,000 per person per shift. Understand that yes, that is a real cost. The cost of the room, whatever it may be, is a real cost. So the real cost was already 4,000-5,000 rupees for a double room, or 6,000-8,000 rupees for a single room, and then you add on this, it becomes a burden. No question about that. The costs have to be met with, because the hospitals are already going under, because the elective work stopped. All hospitals are borrowing money to stay afloat, to pay the salaries. But what do we do? Because people need to be taken care of. The costs have to be met with, because the hospitals are already going under, because the elective work stopped. People, of course, will feel the burden. The government can help. Whatever we can do to help, but we have to cover our costs. So that's the balancing act which is going on, and it is causing misery on everybody, by the way.
There's monsoons around the corner, and during monsoons, most hospitals anyway function at full capacity. How do you cater to patients in this scenario? I mean, you keep hearing about beds running out because of COVID. How do you cater to this new stream of a lot of patients who will be coming towards hospitals very soon?
Well, there are 3 factors at play here. One is that in this COVID lockdown period, we were able to create much larger capacity than we had before the lockdown. So that means that the preparation for, in the anticipation that there may be a huge spike, that we are at least ready for medium amounts of patients coming. I mean, if a crore or two come together, it'll overwhelm the system. But otherwise, we are almost like ready to take on if the numbers go up, which it's looking like it's going up now exponentially.
Sure.
Then we will have some problems. But the good part is that 80-85% are asymptomatic or mildly symptomatic. They don't have to be inside a hospital. For them, we have created what we call COVID care facilities. So this way, large number of patients don't have to come into the hospital. Only the ones who are getting sicker, whose oxygen may be going down, whose heart rate is going up, or respiratory rate is going up, or very high fever, prolonged fever. Those are the people who will need to be in the hospital.
There's a lot written about nationalizing hospitals, private hospitals, taking over of private hospitals. And, there's some countries that have done it. There's some states in India that are offering free treatment for patients in private hospitals that have been taken over by the government. I wanted to get your view on it. What are your thoughts on if such an idea is proposed?
So the problem is that the government, it has its hands full. They don't have enough staff for their own hospitals. They don't have enough facilities for their own hospitals. Now, so the nationalizing is not the answer, because what does that mean? You take it over and you say, we will staff it, we will run it, we will finance it. Where is the money in the world that this will happen? Because it doesn't make sense. What makes sense is to say, today what is happening already is the government and private sector is working closely, very closely together in complete communication of what is required. So the hospitals have been informed that you please keep X number of beds free for COVID patients, which we may send you. So you have been under the Pandemic Act. The government has the powers to requisition anything. So what they've done is let the hospitals be, say 20% of your beds I'm requisitioning. In Mumbai, it happened 80% of the beds because of how rampant it is. And it may happen anywhere else also. But it's a wrong idea. I mean, it's not a very responsible idea that you nationalize. It's not like a bank that you're going to keep to cost money, doctors, paramedical, everything, to run an institution.
I just want to end on asking you one question. Dedicating a percentage of beds in a hospital. Now, Medanta may have several blocks which they can dedicate separately for COVID. For a lot of other hospitals, that might not be the case. So if you say 20% or 30% or 80% of beds be requisitioned for COVID patients, is that a viable strategy?
It all depends what happens. If you look at Delhi, if you look at the Delhi government has got an app which shows you how many beds were made for COVID and how many are occupied and how many are empty. So 50 to 60% of the beds are empty right now. There is enough capacity in Delhi. But the problem is the people are having problem finding out where to go. So there is a lot of confusion right now. I think that can be clarified very easily. That you have a live dashboard which shows if you are in this location, this is the closest and these are the number of beds available there. You can please go there directly rather than running around figuring out where to go.
Okay.
So that is, I think, the important part, that we need to have a very a backbone which will actually guide everybody in the right direction. Because when you're sick, there is one, you're not well, the other, you're in a panic. So the guidance must be there.